us. New figures show a dramatic jump in opioid deaths in the Twin Cities.
At the same time, federal lawmakers are pushing for new measures to keep an especially lethal form of opioid from coming into the country. The new figures released by a prominent Twin Cities drug abuse consultant show that opioid-related overdose deaths in Hennepin County alone rose 57% from 97 deaths in 2015 to 153 deaths in 2016. As bad as that is, authorities are warning it could get worse. That's because of a small but growing number of deaths in Minnesota from carfentanil. The synthetic opioid is 100 times more powerful than fentanyl, the opioid that killed Prince. Esme Murphy joins us now with more. Esme, this is disturbing.
Very, very serious, Amelia. The gravity of the situation was highlighted this afternoon at a news conference featuring Senator Amy Klobuchar as well as top local and federal officials. They outlined a series of measures to rein in the growing crisis. In a tour of St. Paul United Hospital's emergency room, Senator Amy Klobuchar got a lesson in administering the life-saving opioid antidote, Narcan.
Oh, you just put it in the nose.
You just give it a good squeeze, yep, right there.
A Klobuchar bill is aimed at the latest opioid threat, closing a loophole that allows a synthetic opioid called carfentanil to enter the country via the United States Post Office.
It is tough to overstate the urgency of the crisis and the need for action.
The tiny amount of carfentanil next to a penny is enough to sedate an elephant. A microscopic amount can kill humans and is already being blamed for 5 deaths in Minnesota.
Individuals that are trafficking in this drug are peddling death. There's no way to sugarcoat it.
Another Klobuchar bill would create a mandatory opioid registry to curb a wide-scale practice known as opioid doctor shopping.
I met a provider, a rehab guy up in Moorhead that had a patient that got 108 different opioid prescriptions from 85 different doctors in 50 different towns.
This is what a person with a disease of addiction looks like.
Lexi Reed Holtom, herself a recovering addict and the executive director of the Steve Rommler Hope Foundation, says doctors and patients need to know anyone can get hooked.
A third of the people that are prescribed opioids become addicted to them.
Now, Senator Klobuchar's opioid registry would require states to share information from their registries to cut down on doctor shopping. In the example the senator mentioned, that patient was actually getting prescriptions in at least 5 different states, including right here in Minnesota.
Esme, does Senator Klobuchar believe that there's a chance of any of these bills getting passed? I mean, because there's just so much division in Washington right now, it seems.
Well, actually, the senator says she is optimistic because both her bills have bipartisan support, and she says she is hopeful that President Trump, who talked about the opioid epidemic on the campaign trail, will also be supportive.
All right. Thank you, Esme.